Thank you. Well, I must say it's very difficult to know where to even begin. But Mr. Smith, you made the most outrageous statement of anyone when you stated, quote, that you care deeply about the patients who take Daraprim. I'd like to draw your attention to Exhibit 8 and Exhibit 9. Now, clearly, you know that Daraprim went from being modestly priced to being prohibitively expensive. And when you started to hear of access problems, according to a Skype exchange that we have, which is shown in Exhibit 8, you say, I think some of them are fake. You participated in a Skype chat with two of your colleagues in which you expressed shock that two patients had paid cash for Daraprim. Let me read from that chat, although it's difficult to do so because of the number of expletives in it, in which you are making fun of patients that are paying the full amount. Two patients have paid cash for Daraprim. Rich, expletive deleted. Oh my God, wow. You then went on to discuss concerns that you had with the 340B Medicare program. This is a program that provides needed medicine for our nation's desperately poor. And you expressed concern that it was cutting into Turing's profits. So as we can see from the slides, your colleague, Mr. Crutcher, wrote, time to dip out of the 340B claims, expletive deleted. F these guys. Your reply, laugh out loud. Yeah, I told her to start disputing the 340B claims. So, Mr. Smith, that exchange alone, and there are many more that I could have pointed to, make it very difficult for me to believe your statement when you express your deep concern for the patients. Would you care to respond?
Yes, I'd like to provide a little bit of context about this exchange. The 340B program, it makes up approximately 66% of Turing's, the volume of Daraprim that Turing sells. And there is some, within the industry, there is some concern that the 340B program is occasionally abused for fraudulent use, where a hospital may purchase a product at a much lower price to then sell it at a higher price. So those comments that I was making in this informal discussion between coworkers that have been working together for many years, and there's many stupid comments in here, and regretful language. That was the genesis of those comments.
Well, LOL, yeah, doesn't sound like you're really talking about fraudulent claims. The whole tenor of this exchange is, can you believe there are suckers out there who are paying the full price? Can you believe that that we're concerned we got to start fighting back on the 340B program? There's nothing in there that expresses an iota of concern for the patients who are getting help through the 340B program. Nothing at all. Mr. Tillis. Daraprim has been on the market since 1953. Is the Daraprim pill that Turing sells today essentially the same pill that has been on the market, the same medicine that has been on the market since the FDA approved the drug in 1953? So Turing didn't do any R&D to develop Daraprim, correct? since obviously Turing didn't exist until 2014, and this drug has been on the market since 1953. So the R&D was done before, decades before Turing even came into existence. Correct? What improvements did Turing make to Daraprim to justify raising the price of the drug from $13.50 a pill to $750 a pill?
We are now focused on R&D for the next generation of toxoplasmosis. We have Dr. Eliseo Salinas, who is adequately qualified to develop new programs, and we are very much focused on R&D going forward. Initially, no. Now, yes, there are, as you mentioned, the drug has been around since 1953, and we are not aware of any other pharmaceutical company which ever paid it any attention to try to develop it in any way going forward.
So
some people, oh, sorry, go ahead.
We've heard testimony today that Daraprim works just fine, that it's the gold standard. In fact, if you look through Turing's documents, it is repeatedly described as the gold standard. So no matter what the story may be now about your R&D plans, the truth is that Daraprim is exactly the same today as it was 60 years ago. The only difference is that the price has been increased by some 5,000%.
Correct, and since I began at Turing, we've had actually many experts in the field come in, and you're correct, it's been around since 1953, but it doesn't mean because of that it's the best version. My understanding is that there are many patients who don't tolerate Daraprim very well, and there actually is room, there are some toxic effects, there is room for improvement. So I respectfully would have to disagree that there is nothing that can be done to improve the lives of Daraprim patients. It is actually a cyst that is very hard to destroy. It's actually not originally an AIDS drug, it's a cyst, it's a parasite that infects you, and there's actually apparently 3 billion people globally who have this parasite. Someone in this room could have it. So it's actually, there is room for improvement.
So what percentage of your revenues are you spending on R&D today?
So last year we spent roughly, I think as we described earlier, about 60% in R&D.
60% of R&D
Last year.
does not add up to the figures. Are you talking about 60% of the increase in the price of Daraprim?
No, I'm talking about in terms of any kind of revenue that we make.
Because there's a conflict between your testimony and the testimony of your executive who testified on the House side in that regard, since she said it was of the increase in the price.
She might be correct, actually. So
let me turn to another issue, and that is Exhibit 5. This is a personal letter directly to you from the leaders of the HIV Medical Association, the Infectious Diseases Society of America, and the Pediatric Infectious Diseases Society. This letter contains a personal plea to you. It notes that you're the newly appointed interim CEO of Turing, and it pleads with you to lead the company in a new direction that places patients' interests and lives ahead of short-term profits by taking the step of reversing Turing's price increase on Daraprim from $13.50 a pill to the $7.50 a pill. And it goes on to note that despite Turing's repeated assurances to the contrary, the $750 per tablet price has wreaked serious havoc on patient access to the treatment of toxoplasmosis, resulting in treatment delays and interruptions. Now, you said in your deposition that you were out of the office at the time that this letter arrived. What when you became aware of the letter, what did you personally do to respond specifically to this December 22nd, 2015 letter from these three prestigious medical groups?
Yes, as I mentioned before, this was not actually my area of expertise, but it is of great concern. So I discussed it with Nancy Retzlaff, who again is here in the room, our Chief Commercial Officer, and my understanding is that she made every attempt to reach out to all these organizations.
What have you personally done in response to this urgent plea to reverse the price increase of Daraprim?
Well, again, with all due respect, we have actually reduced the price of Daraprim across the board, first to hospitals by 50%. And as I earlier described, 2/3 of patients basically pay 1 penny a pill. So that 750 number is a little bit inaccurate if you look at the entire patient population.
Well, the hospital price, let's say you cut it in half, it's still going from $13.50 to more than $300 a pill.
But again, the majority pay a penny a pill.
Well, I would suggest to you that we talk to these three medical societies, and they tell us that you've done nothing to respond to their letter, and that you've made virtually no changes in your distribution pattern or your pricing. Senator McCain.